Ignore that. All right. Hi, folks. Thanks for being here today. So this was a project that we undertook back in the summer of 2021, and really excited to finally get around to sharing some preliminary results. Keep in mind, this is very preliminary results. So feedback is super welcome, and we'll have like a Q&A at the end where, we could solicit feedback and hopefully shape this into an even better project. So we're going to be presenting, our talk is called Evaluating the Afya Bora Fellowship in Global Health Leadership Program. And Mehr and I are going to present. So we're going to start off with some background, and I'm going to hand it over to Mehr.
Yeah, thanks so much, Mesha. So just to go into some background about the Afya Bora program and the context, we've known for many years now that sub-Saharan Africa presents an ongoing trial in the fight against HIV, and we've really seen the need for strong global health leadership systems and the ability to support emerging leaders in global health, which is an anchor for keeping public health systems and healthcare systems in general in place. And in response to this need, there have been many programs implemented in countries like Zimbabwe and Uganda, recognizing the insufficient leadership management and training opportunities for emerging leaders in global health. And the Afya Bora program is also a program that was that was created in response to this need, and we sought to address the fact that we have so much enormous talent of health professionals in lower middle income countries, but on the other hand, there are not enough leadership and training opportunities. And we really sought to address this so that we could help strengthen these public health systems and make an impact on communities that way. So Afya Bora trains healthcare professionals we train professionals across 8 countries in sub-Saharan Africa. And the name means better health in Swahili, created in 2009. And it's a leadership training program, and we strove to inspire and strengthen leaders in healthcare in sub-Saharan Africa. And the program was funded by the Health Resources and Services Administration and PEPFAR. So these are partnerships. It was a partnership among 8 universities in different countries, including the US, Uganda, Tanzania, Cameroon, Botswana, and Kenya.
Great. So the program initially was advertised broadly among all the universities that we partnered with. Applications were reviewed by a selection committee, and the committee consisted of leaders from both program and community leaders at these African universities in the countries that we mentioned previously. They evaluated participants based on initiative, innovation, collaboration, and a whole bunch of other skills. And we did strive to strike a gender balance between our fellows. Selected trainees were then interviewed and then eventually matched with what we call attachment sites that aligned with their interests and both professional goals. So over the program it was established, I think, in 2009, but ran from about 20. So our first graduating class was from 2011, and our last graduating class was 2021. So over 10 years, we had over 200 fellows graduate from the Afya Bora program. This is a really quick overview of what the program consisted of. We're not really talking about the program itself today, or rather an evaluation we did of the program. Therefore, I won't go into too much detail. But, there was orientation, there were modules for leadership, program management, implementation science. For those who were rotating at attachment sites, there would be specific mentoring, meetings with country leads and other fellows. So a lot of networking going on there. And then they would present their projects and then also have another rotation. So that was generally the format that was followed. Over time, this program's been running for a while. We've had quite a few publications on the program and what it strives to do, what it's achieved so far. And all of it was super academic, which is awesome. But we never got an opportunity to truly see where the alumni ended up from the program, which took us to kind of undertaking this project, where our aim was really to evaluate the impact of Afya Bora on its alumni, and specifically on the domains of like professional development, multidisciplinary work, and familiarity with research methods, both like the impact on the alumni and the impact that the alumni had on public health in their respective countries. We conducted a mixed method study, which is to say there was a quantitative portion and a qualitative portion. For the quantitative portion, we conducted a red cap survey of all the alumni graduating from 2011 to 2021. And then we have descriptive analyses of those alumni. And then for the qualitative portion, from a subset of the folks who responded to surveys, they self-selected and we conducted guided interviews of those alumni. So we have 22 of those interviews, and we conducted those interviews while assessing for thematic saturation. Interviews were conducted by 2 different team members. The interviews were also stratified by gender, country of origin, and profession. We'll give you a breakdown of what those 3 looked like in the survey and how we tried to make sure we were representing overall all of the alumni as best we could. There was coding by 2 people in vivo for the thematic analysis, and all of the data was collected in the summer, so between June and August of 2021. So some results: we had about 67% female who responded to, this is the quantitative part, so the survey results that we're presenting first. 67% were female, an average age of 38.16 of when the fellows started the program. So not when they graduated, but when they started. 44% were physicians and 41% were nurses. So majority were in the clinical setting. In terms of the organization of when they started the program, 41% were academic institutions, 33% at Ministry of Health of the respective countries, and 21% were nonprofit organizations. Only about 5% were in some other public health or other specific role that didn't quite fit into any of these categories, or international organizations. As you can see here, the folks that participated in the survey, majority, or the largest category of them, had graduated at that time most recently in 2020. So it makes sense that folks who had more recently graduated were more engaged in this research. The country of origin, we have not exactly an even distribution, but we do have a large, around 20% for most of the African countries, other than Cameroon, which was a little lower. So when we asked folks about after their graduation, what unfolded, 93% of folks said that Afya Bora did influence their overall career trajectory. We can see almost 30% pursued a PhD in further education after graduating from Afya Bora. 18% pursued something else, and we have, folks who pursued other fellowships, masters, or different degrees. Only 34% didn't pursue any kind of further education. 95% actually, at the time of the survey, were working in their home country. So this idea of fostering leadership to stay in their countries would seem pretty successful. Additionally, 39% were in academic institutions following the program participation, 31% in ministries of health, 18% in nonprofit organizations. So yeah, it was reported, sorry, I'm trying to move this thing because it keeps blocking the screen. A large percentage of folks did say that they assumed a position of greater influence through creating kind of a wider network through the folks that they met through the Afya Bora program, whether that be peers or mentors or other connections through talks. So yeah, folks, there was also a lot of job changes, a lot of promotions, as we mentioned, higher education. When we talked about alumni's specific skill sets that they had built or that they were currently using after the fellowship, 73% that said that their professional knowledge or skill set was elevated post Afya Bora. 83% said that they had more self-confidence and perceived themselves as a leader, and 76% said that they had a strong effect on their leadership style and ability. So overall, pretty high percentages that seem to build these new skill sets through the Afya Bora program. In terms of the impact on alumni, 68% said that Afya Bora directly contributed to strategic collaborations that resulted in either new programs or policies, institutions, or organizations. And this is something we did want to dig into more through some of our qualitative work. We found that 45%, and these are overlapping categories, which is why they will not add up to 100%. So 45% expanded services to benefit new populations, 50% increased efficiencies on how their programs and services were being delivered. Over 60% improved the quality of data collection and use. So that was a major focus, and there were classes on improving data quality. And so it looks like that really did have a long-term impact on our alumni. Lastly, we asked them about their existing networks of Afya Bora alumni in their country. 64% said that yes, there was a group that they were aware of. However, we had pretty low percentages of folks who were involved. So only about 21% were very involved, with the majority of folks not somewhat or not really involved in meetings or activities in the previous year. And folks also, we asked them about their frequency of contact with fellows from their cohort. And again, these were not super high. So occasionally it was 58%. And most people didn't really have contact with alumni, mentors, or working leads within their country. I'm going to hand it over to Mehr now for some qualitative interviews.
So now to transition over to the qualitative results that we observed, we conducted 22 qualitative interviews with past alumni, and we assessed for thematic saturation along the way, and we targeted an even distribution of individuals across sex, country of origin, profession. And here are some of the results that we found upon transcribing the interviews and analyzing them. So a lot of participants reported post-fellowship recognition. That was one of the major themes that came up. So 81% of those participants received a promotion, 61% received at least one grant, 67% published research papers, and 13% received awards or were recognized for their work. And in terms of research, that was another major theme that came up. 90% said that the Afya Bora program helped them to strengthen their research skills, even if they didn't have any publications after the program, and 68% were involved in research after the Afya Bora program. Two other major themes were mentoring and professional development. So within mentoring, 56% found the mentoring during the program helpful, either in terms of mentoring they received themselves or if they were able to mentor others. 67% mentored others following the Afya Bora program as well. And professional development, 90.5% said that the program was beneficial to their professional development. 95% felt they developed leadership skills, and 90% were involved in projects making an impact on the African health systems. So as we mentioned, we conducted thematic analysis on these 22 interviews, and we identified these 4 major themes that came up the most that we have outlined here, interviews from these interviews. So networking, research skills, publications, and leadership skills. And I'm going to talk about these in a little bit more detail with some examples from the interviews that they came up in. So in terms of networking, we define networking as improvements in communication and networking skills with professors, peers, instructors, or helpful career contacts enabled by the Afya Bora program. So here are some direct quotes from our participants that we observed during these interviews. And one quote that I can read out loud here that I'd like to highlight is, there are a lot of alumni networks that have been set up. I think there's a Facebook group. They're also trying to create a LinkedIn group to connect past alumni, and they're using hashtag Afya Bora on Twitter. And I should also mention that although many participants were aware of the alumni networks, there were also a good number that we observed during the interview that were not aware of this. So that's a potential area for growth in the future. So I'll give it a couple seconds so that you can read over the other quotes on this slide. Okay, so the next major theme that came up was research skills, which we defined as improvement in comfort level with the scientific process, writing and publishing results taken from the Afya Bora program. And so these are, again, some direct quotes from our participants. One quote here is, "We have incorporated quite a number of the aspects from the Afya Bora program, especially in terms of responsible conduct of research ethics, and all those modules in our postgraduate programs." And again, like I mentioned, even if participants didn't directly have publications or weren't currently involved in research following the program, they still felt that the program had helped them better their research skills. So yeah, again, I'll give it a couple seconds so you can read the other quotes. Okay, next thing was publications, which were published research papers after Afya Bora program completion. And many participants brought up in their interviews that they felt they'd been able to use the research skills that they gleaned throughout the program in their publications. So one quote here, for example, is, "I was able to publish the research I did at Afya Bora. I'm currently working on a manuscript on a integrative biological behavioral study on key populations in Botswana covering behavioral surveillance." So we can take a couple of seconds here to read the others. Okay, and the last thing that we highlighted here is leadership skills. So leadership skills are so we defined as increased comfort level following graduation from the program, leading and knowing how to manage teams effectively. So this was one of the most significant that we observed, because many of our participants reported receiving promotions following the program, and many brought up in the interviews that the leadership skills that they learned in terms of working with groups and managing a team had helped them in their new position. So, for example, one of the quotes you have here says, "I was appointed my position because of Afya Bora, because of the leadership skills I gained at the program."
So this takes us to some of our strengths and limitations. So some of our strengths were there were mixed methods. So, the initial survey gave us a lot to think about, but it's usually hard to dig deep into reasons behind why folks got something out of or didn't get something out of a program. So doing those interviews helped us delve much deeper into the reasons behind why folks were saying what they were saying in the surveys. We had participation from across professions, although majority of our participants were either doctors or nurses, medical doctors or nurses. We did have some other folks in there as well. We got participation from across all cohorts, although heavily biased towards more recently graduated cohorts, and of course, all the countries. Limitations, there was, of course, recency or recall bias. So folks that graduated more recently were more likely to remember more of maybe what they gleaned or got out of the program. And they may be more likely to attribute some of their successes to the leadership program that maybe folks who have been out in the field for a while, maybe graduated 9-10 years ago, maybe would not, or have since had other things to attribute some of their successes to. And of course, selection bias. So the way we selected folks for the qualitative interviews were we actually asked the working group to who they would think was, would be more likely to participate. Unfortunately, they didn't have very specific guidance. So we ended up responding to kind of reaching out to folks within our sex of we reached out to an equal number of men and women, et cetera, to make sure we had them. But it makes sense that those who responded were more likely to sing praises of the program. Although we hope that through our training of our interviewers that we were able to kind of get to the heart of how they actually felt about various aspects of the program. In conclusion, alumni responded generally positively to the fellowship program. Afya Bora seemed to be influential in alumni in both their personal and professional goals, and participants did report having a stronger vision for their future professional pathways and greater confidence in general in a variety of their skill sets and ability to work in these professional settings. They also, from their perspective, have had significant impacts on their various countries' African healthcare systems. It did seem like there were some limitations in terms of research opportunities. For example, a lot of folks wanted to work on grants or publications, and they were limited in their positions, especially they just didn't have time to work on what they wanted to. And perhaps there's a need to improve or maintain some of our alumni networks long term. Those who were part of those networks seem to get a lot out of it, and those that weren't either didn't know they existed or wanted more involvement. So maybe that is something to work on. We would like to thank, of course, Carrie, who's been amazing and very patient as we have conducted most of the survey and data collection back in 2021, and it's taken me a while to get us to where we are today. Nikki Lishgold, who was an undergrad. I guess she is now a graduate student in Columbia, I want to say, or NYU. I know she's on the East Coast. Carrie, you can tell us where okay. Michaela, who was an undergrad, who helped conduct all the interviews in 2021. Margaret, who has been an invaluable resource in Kenya. The whole Afya Bora working group, without their guidance, a lot of this work would have been really difficult to do. And of course, the IRTP staff. Thank you, as always, for your patience with me as I bombard you with 1,000 questions. And we have our funding sources at the bottom.
I also want to give a big shout out to Dr. Farquhar and Mesha. Thank you so much for your patience and understanding throughout the whole process. I've been learning so much from both of you, and yeah, this has been so amazing.